LCP report, Hiding in Plain Sight, has been a work in progress over the last 2 years, and the focus was how we treat people for tobacco dependency in the NHS today. So we're hoping that this report will make a real difference and will be a real call to arms for people to start treating tobacco dependency in the NHS to save lives. The thing I think that we all value and love about the NHS is that we can all access it. It's there for everybody all the time. But it's really important for our generation looking after the NHS that we make sure it's sustainable. And one of the ways that we can do that is by treating tobacco dependency, reducing the prevalence of smoking, reducing the complications and the costs associated with smoking. We've identified that we can save over £1 billion every year if we help people to stop smoking, and they would be recurrent savings that we can use to fund other parts of the NHS. So it's a win-win situation, and we can make our NHS more sustainable if we do this. First, get trained in how you have conversations. There's free training online, there'll be training in your trust, and it's fairly straightforward. You just ask people if they smoke and refer them to treatment if they do smoke. And so one of the things we'd really like to see is training for smoking cessation being adopted by all healthcare institutions, GP practices or hospitals, and also it to be included in all the curriculums of the different professional groups. The second thing we can do is create a smoke-free environment in our hospitals. Smoke-free environments doesn't mean just putting up a couple of posters and taking away the shelters. A proper smoke-free environment means treating the patients inside the hospital. So giving them NRT, referring them and starting to treat their tobacco dependency, treating our staff who use tobacco. And this work occurs over several years. It's not an on-off type phenomenon. It needs continuous work and input. Commissioners need to invest in hospital treatment for smokers. We need to treat people on an opt-out basis now. We need to make sure that pharmacotherapies are available in every hospital, and all of these things together will make a real difference, and it'll also reduce the burden on future healthcare. So even though smoking causes the most preventable disease in the NHS, there is no data collected on its treatment. So one of the things we want to propose that we do is link up all the data between secondary care, primary care, stop smoking services and local government. Use that data collectively to really drive improvements. Not changing what we do about tobacco is not an option. It's not right that we should continue to incur billions of pounds of extra costs each year, that more than 80,000 people in the UK die each year from a preventable disease. So carrying on in the same manner should not be an option for any healthcare worker, for any provider, and for the NHS as a whole.